There wasn't a huge amount of substance from Therese Coffey there, it must be said. There were bits and bobs, but in terms of GPs, as far as I could tell anyway, what she was saying was, you just need to see more patients.
Well, it's interesting. I think Professor Marshall's statement this morning was quite conclusive, really, on this. I think what's happened is there's a lovely rhetoric that's come through of we need more appointments, we need to be seen, this is the big issue. But actually, sadly, the statistics count against what the Health Secretary said. 85% of people are seen within 2 weeks, and 44% are seen on the same day in general practice, which doesn't suggest that appointments are the burdening issue. What actually is one of the big issues is really the amount of staff we have, and particularly GPs, because GPs deal with really complex medical issues and that can't just be done or solved by papering over the cracks with some of the proposals today.
Would it be fair to say that some GPs spend too much time working in the private sector? If they devoted all their time to NHS, maybe that 85% of patients who get to see the GP within 2 weeks could get closer to 100%?
No, I don't think that would be fair at all. I think GPs work extremely hard, and I think NHS GPs are working to full capacity. And I think we've talked about this on previous shows where when we discuss a 10 or 12 hour day and we calculate that across 3 or 4 days, that is more than most people are working in a 40-hour week. So actually GPs are working extremely hard, and what they do outside of that time is for them to choose. But I think the key point here is focusing on what the Health Secretary said, because actually our issue here is we've been promised 6,000 GPs, but clearly that's not enough. And what we really need to focus is on retention of the current GPs and not trying to break their back by adding more work and adding expectations which are placed upon general practice without a substantial plan. We need to tackle the bureaucracy that is existing in general practice, and we also need to do things that are simple, upgrade IT systems and upgrade premises to incorporate more services in primary care.
Yeah, OK. I mean, some people are saying that actually for an average of around £112,000 a year, it would be expected maybe that there would be longer hours involved in that than maybe your average job, I suppose. I mean, does that not stack up? Maybe you would say that the pressure is too high. The pressure's a lot higher. You can't equate that with the money.
Sure. I think 7:30 in the morning till 6:30, 7:30 at night is pretty long hours. I'm not sure how much longer you want GPs to work,
3 days
how many more days you can squeeze out. I think we need to be very careful in the way we conduct our conversations and look at our timings, because we're very clear to say the GPs come in early, they're doing their paperwork, they're looking at the data, they're looking at the results of patients, calling people before surgeries, then they conduct a surgery, then they'll do visits or other admin, and then they'll do an afternoon surgery. It's just that the time, of course, to see patients, maybe 3 or 4 hours, but of course within that, there's all these other things that need to be done as part of primary care. So I think we need to be really careful in how we utilise our time. But definitely, I know from my colleagues and myself, we're working very, very hard.
Yeah, how do we get more GPs then? Because, frankly, that would solve a huge amount of issues, wouldn't it?
Absolutely, yeah. And I think this is one of the key things that we need to iron out. Now, the government's promised 6,000 GPs, but realistically, we know we need more. And I think what really needs to happen is we need a longer consultation with the primary care leaders. This statement from the Health Secretary team today was without consultation with Professor Marshall, head of the RCGP, without consultation with GPs who are on the front line, who are doing this work and saying, well, how do we do this? Some of it is to do with how we alleviate some of the burdens on general practice. It's a catch-all for all problems at the moment. And of course, there are welcome support from allied healthcare professionals, but we have to look at how we incentivize general practice and how we also retain our GPs rather than working them so hard that they feel they've got to explore other avenues or leave the NHS. So there's a combination there. I think one thing I would say is we do certainly share the frustration of the public. I really wish I could see more, and I wish there was more capacity in the system. So really the key point here is more GPs, more capacity, patients can be seen quicker.